Harvard-trained, board-certified anesthesiologist, and we're going to talk about traumatic anxiety relief today because it happens all the time with my patients. In fact, the ones I had earlier today, and we were able to overcome it in ways that you probably didn't think possible, and I want to share those very powerful secrets for how my patients, even in the most stressful situations like here in an operating room, can overcome those traumatic anxieties, whether from PTSD in the past or from the trauma of surgery or anything else that's going on. And we had to quit the last live stream. YouTube invited me to their guest new functionality so people can come in and ask me live questions, but I think that was causing the audio to have problems, so we restarted it here and no guest invites, but I'll let them know that that didn't work out, and I'm happy that everyone can hear me. Pika, Kirby, Brenda, Lone Star, Heidi, all great to see you, and Enola. Let's jump straight to it because I actually have all the medications that I'm going to use for a case later today, and I want to tell you about them and tell you how they impact anxiety and, more importantly, how you can overcome anxiety with the 3 C's. If you take anything away from this, please take away the 3 C's, which are the antidotes to anxiety. And that's control, curiosity, and certainty. These 3 are our natural tools for overcoming anxiety, even without the medications that I have here that I give patients, or like these. Those 3 C's don't have any of the same properties that these medications have, the addictive properties, etc. These are very safe to use. I'm going to use them in a couple hours, but they can't be used for too long of a time because of those side effects. When my patients are having a ketamine infusion with me or they're having surgery with me, I use these medications in conjunction with hypnosis and other therapeutic approaches to minimize the amount of anesthesia and other medications that they need because of those side effects. Question from Kiernan, good to see you on. When I have anxiety on the table, I just talk about my favorite things. I had jaw surgery 8 weeks ago. All I did was talk about dirt racing and my oral surgeon held my hand and went to sleep. Perfect. So Kiernan has already gone into one of those 3 C's, and that's control. Whether or not you have these medications which actually take away your control, you can have control like what Kiernan did about taking ownership of what the conversation is going to be about with the trusted medical team. Outside the operating room, this is where I use the breathing techniques and the mind-body techniques. As I've shown you many times before on my own body, you can check out those videos where I've connected myself to the ventilator and to all the life support monitors. You can control your heart, how it beats, how fast it beats, the variability, how your lungs are working, your body temperature, so many other parts of your body you can control. And that is one of those 3 C's there about overcoming anxiety. When we have control of a situation, we are less likely to be susceptible to anxiety. It's not 100%, that's why it's only one of 3. So distraction can certainly be powerful when used appropriately. However, if we're too distractible, it's a different situation. If we're too avoidant, we might be denying the underlying cause of our anxiety. It can then turn into generalized anxiety disorder, and that can be problematic. Now, on an operating bed like this or a procedure bed, this is a pain procedure room, by the way. You can see the x-rays, the monitors, and of course, the anxiety meds, or the anesthesia meds that I have that I'll talk about in a minute. In a case like this, very appropriate to invoke one of these distraction techniques because it's a time-limited stressor. The trauma of the procedure might be 20 minutes, 30 minutes, even if it's 3 hours, it's finite. It's not going to always be there. And I use a lot of these distraction techniques with my patients all the time to help them gain control of a situation. However, when we're living our lives outside the operating room or outside a procedure room like this, where you're not going to get medications connected to you intravenously, you're not going to be able to just run away from the inevitable stressors of life. We need to use the other 2 C's as much as possible. That's curiosity and certainty. I'm seeing great comments. I'm so happy that Heidi is sharing about the Yoda breathing and the Yoda technique today. That'll go into curiosity, which we'll talk about next, and how it helped with her insomnia. Heidi, I'm really happy to hear that. That's without any sleep aids, none of the Michael Jackson medications or the benzodiazepines that patients use, things like Klonopin, temazepam. These are all benzodiazepines, like the one I'm holding here, which is midazolam, that have side effects when used for too long a period of time. When we try to apply denial or distractive techniques to treat generalized anxiety disorder simply is not going to work. On that topic, I actually have to start preparing some meds. Let me just quickly show you how that works, because people always ask. I like to run propofol infusions. I know a little digression, but patients really are interested in this. I don't like to use anesthesia gas whenever possible because of the nausea side effects. So this is what it looks like when you draw propofol. I use the spike here, so it's much less stress on my fingers. Propofol, I'm going to give it IV. So I do this when I'm doing a sedation case. If I'm going to be doing some clinical hypnosis, I'll give a very low dose of this as I help instill curiosity in the patient about what their body is experiencing. The same thing goes for things like ketamine, etomidate. Those are the three most powerful sedatives. And midazolam, which is a benzodiazepine, I do not use if I'm trying to get a psychedelic experience, because then the patient's going to have amnesia. So I don't mix these two together. I use it for other cases, but not in a case when a patient particularly wants to remember the experience, to drive that curiosity or to grow that curiosity. As we said, that can help with generalized anxiety disorder. Even when you're done with the procedure here, you can go on to get your generalized anxiety under control instead of just trying to deny or run away from it. A lot of questions here. Oh, hey, Mary made it onto Alive. When I had endoscopy and was given fentanyl and propofol, these two, I had an instant headache, major pressure in my head. Can you tell me why? This medication is a vasoconstrictor in the brain, meaning it actually lowers, it makes the, it makes the blood vessels smaller. So this medication in and of itself typically does not cause that headache. However, I wonder if you had a headache when the endoscopy started, because that certainly increases pressure in the chest and the head when the endoscopy goes in, the endoscope goes in. So it could be related to that, or it could just be from hypotension, because propofol vasodilates vessels outside the brain, and that can cause all sorts of unusual sensations when given in large, fast doses. If I'm doing an infusion for somebody for sedation or for clinical hypnosis augmented with anesthesia or ketamine or whatever, I don't like to do a giant bolus dose because of exactly what you said. I like to do it as slowly as possible to minimize the side effects when it's clinically appropriate. Good question. Lee Womack, good to see you. I'm so tired in the morning since I have a habit of staying up late, since I have to go to the hospital early, I just look forward to the sleep. So Lee is talking about the process of kind of death of the ego, which is a very, very powerful technique for overcoming anxiety. It's actually it's one of the end results of the most powerful psychedelic experiences, to be able to not give up, but to give in to what the environment is pushing us into. We can talk about that more later on, but Lee's very, that's super powerful for anesthesia in particular, because when we know the limits of our control and what the situation dictates, there's a lot of healing that happens when patients can figure out where their control ends and where the environment takes over. Well, I'm getting bombarded by messages here in the middle of the day. Anyways, we'll have to talk more about death of the ego, and that needs its own special live stream talking about psychedelics and ketamine. But for the purposes of this, I had to still talk about curiosity, because when patients are getting a medication like this, it's connected to this yellow tubing because it's infused slowly, intravenously, they have an experience. When patients are curious about what's going to happen to their body when they're under anesthesia, we can begin to actually be mindful of the body. And I know this sounds elementary or silly, but when I'm guiding a patient who can't tolerate general anesthesia because of side effects or because of any other reason, fear, etc., clinical hypnosis can fill in the gap between low dose of anesthetics with their psychedelic properties and plus clinical hypnosis can help a patient be very, very comfortable for a procedure without those side effects. But we do it by engaging mindfulness. Hypnosis is a state of suggestibility We've talked about this in other live streams. It's also characterized by intense focus. When we can focus on our bodies, our breathing, our emotions, what sensations we're feeling, our skin, muscles, bones, etc., we allow for curiosity to overcome the sense of anxiety, which is characterized by pretty much all of the opposite. This is where mindful breathing comes in, with the Yoda breathing, the 5 and 5 out. Breathing and being mindful of our breathing innately brings up the curiosity of what's happening in our body. You've seen me as I connected myself to monitors, how my heart rate changes. Even without these medications in my body, I can completely change how my body is functioning based on my breathing alone. So mindfulness of our breathing allows for that curiosity to also come up. Very powerful antidote to generalized anxiety. Last one is certainty. And unfortunately, a couple of these texts that I keep getting, I need to actually go and take care of a couple issues, but I'll answer the rest of these questions in a later live. Joanne, I see yours. Kieran, I see you as well here. I just need to finish the last C so that we can talk about this in a later live stream about generalized anxiety. That's certainty. Anxiety invariably comes up when we have doubts about our abilities, doubts of what's going to happen to our bodies, and doubts about how we can deal with what might happen to our body. When we have certainty about our abilities, certainty in the team taking care of us in the operating room, outside the operating room, that takes the form of our loved ones who surround us, then we have an ability to overcome those doubts, uncertainties, and fears, and those are what fuel anxiety. I'll end by saying that anxiety is the angle between what we think we can do and what we want to do. For example, if my patient wants to walk down the street, but they have terrible hip osteoarthritis and they don't think they can do it, there's an angle between what they want to do and what they think they can do that causes anxiety. If someone is confident that they can walk down the street or throw a ball or play whatever sport they want to do, and they don't have any concerns about that, they don't have an angle between what they want to do and what they think they can do. Fears, uncertainties, and doubts make angles in our lives that fuel anxiety, inside and outside the operating room. And that's where psychedelics can help us rethink what is it that we want to do, and why do we have doubts about what we think we can do. They help us rewire through various neuroplasticity processes what our perception of self is, once again, what we think we can do, what we want to do to lower that angle. That's what I work on with my patients. I have to do that in a little bit actually, but I'm happy I got to show you a handful of the medications that I use to accomplish that. Remember, I do not use this guy here because of the amnesia that it causes, and that would defeat the purpose of the whole anesthesia healing experience. I hope everyone learned something. As always, if you could hit that like button to support me doing this more often, I'd really appreciate it. My clinic is in San Francisco, as I'm sure many of you know, where we use ketamine outside of surgery to help patients discover their inner healing potential. And next time, hopefully, the YouTube guest feature will work so we can actually have a live Q&A with a guest on here. Till next time, remember that you have more power over your health than you've probably ever been told. Take care.